Okay, polycystic ovary syndrome is a pretty common problem, especially in younger, heavier women and girls. Basically what's going on is the ovaries are putting out more estrogen, but they're putting out more estrogen because the body outside in the periphery, in the tissues outside of the ovaries, are saying, hey, I need some more estrogen. And the tissues are saying they need more estrogen because they're relatively resistant to the estrogen because they're a little bit heavy. So the tissues in the body say I need more estrogen. They send a signal to the hypothalamus in the brain, which releases luteinizing hormone, which tells the ovaries to make more estrogen. And when they make more estrogen, one of the side effects of higher levels of estrogen is a little bit of additional fat, which makes the tissues and the rest of the body a little bit more resistant to the estrogen. So the tissues in the body say, I need more estrogen, and they send a signal to the brain, which sends more luteinizing hormone to the ovaries, which makes more estrogen, which then releases more estrogen, so then you get more fat, which then becomes more resistant. So the tissues in the body say, I want more, they send a signal to the brain. Now, one of the unpleasant side effects is in your body, a woman's body metabolizes cholesterol-type chemicals into estrogen, which makes women kind of feminine. In guys, we have a different set of enzymes which metabolize the cholesterol molecules down to testosterone, which makes us sloppy, burp, watch football, other things. But in polycystic ovary disease, as the estrogen goes out, and the estrogen goes out, the estrogen goes out, there becomes higher and higher levels of serum estrogen. So a funny thing happens. Some of the estrogen starts to spill over and get metabolized actually into testosterone. So then the patient starts to show signs that are reminiscent of a guy. So they start to get facial hair. They can get male pattern baldness and acne and all kinds of things because that testosterone starts to come out. And all those things are bad. You can also have infertility, so you can have trouble with pregnancies. And all those things are reversed by an MGB. They make everything better. So the polycystic ovary disease is kind of a vicious circle of bad things on top of bad things on top of bad things. And that's all generally made better quickly by the MGB.